Community and public health is the well-being populations has agencies of federal and state and local that work with teams to have the outcomes through structural measurements, procedures, core measurements, and usually starts with the local, state, and federal governments having responsibilities toward good outcomes from the well-being to food issues, using good ethical, legal, and communication to know how to choose their fundings for health care services. Everyone matters. That's why we're working with communities to create better health for all. Community health, an arena within public health involved within the study and improvement of the health of communities and focuses on the geographical areas. Setting includes public health agencies, local health departments, community health centers, community-based organizations. Public health protects the health of entire populations such as local communities and can be as big as countries or regions of the world. Improves the health of families and communities through campaigning of health lifestyles, research for diseases and injury prevention, and recognition and control of infectious diseases. Prevents problems from happening or recurring by implementing educational programs, recommending the policies, administering services, and conducting research. Works to limit health disparities. Public health has a surveillance, monitoring, analysis, outbreaks, epidemic, disease prevention, communication, risk, research, and public health. Public health promotes health equity, quality, and accessibility, and public health ensures conditions as a result people can be healthy. Agencies: the Federal Department of Health and Human Resources, Centers for Disease Control and Prevention, Health Resources and Service Administration, National Institute of Health, Food and Drug Administration, and Agency for Healthcare Research and Quality. Main leadership for public health policies: U.S. General Surgeon and the Centers for Disease Control and Prevention. Public Health and Community Health: U.S. Department of Agriculture, Environment Protection Agencies, Occupational Safety and Health Administration, Department of Defense, Department of Veterans Affairs, Department of Homeland Security, FEMA, County and City Health Departments, Local Board of Health, State Territorial Health Departments, Public Health Service Agendas, Tribal Health Agencies, Public and Private Laboratories, Hospitals, Private Sector Healthcare, and Volunteer Organizations. What does community and public health need? Teams of public health such as professionals, physicians, epidermists, nutritionists, and others, all specializing in public health, community medicine, infectious diseases. Community Health Center, team-based services. Structural measurement. Informational resources, organizational resources, physical resources, human resources, and physical. The procedures of public health are those that recognize and focus on health issues and are coherent with the mandates and community main concern. Chronic diseases is a public health issue where the population's health outlook for developing strategies, interventions, and policies to combat it is a critical disease. In the populations, the viewpoints, the reflection of how the person's biology, genes, and behaviors interact with social, culture, and physical environment around them to influence health outcomes for the whole population. Assessment, policy, assurance. Federal, state, local, and local governments all have some responsibility in these functions. Assessment. Monitor health, diagnose and investigate policy developments, inform, educate, and empower, mobilize community partnerships, and develop policies. Assurance. Enforce laws, link to provide care, assure competent workforce, security issue. Local government, state government, CDC, and FDA, Homeland Security, all have the responsibility in resolving the issues to keep the area healthy. Providing preventative health care, especially for those with special health problems, is a state responsibility. A state may contact with local health officers or private agencies to deliver preventative health services. The state also may arrange for certain individuals to be served by health centers operated by federal, state, or local government. Some of these centers aid people who have psychiatric problems or who abuse drugs. Health ethics concentrates on population, communities, and foundations, independence of individuals, authority assigned in the laws of the states. Society consists within the policy process, community good, and preventing community harm, social justice and equity, and provides continuing study, planning, and validation for public health action and policy, usually when law is unspecified. Legal and ethical measurements of community and health public. The ethics of community and public health is for the greatest good for the greatest number within the geographical area. Laws are usually put into place to protect the greatest number of people for safety of community and public health. The practice for a state to take responsibility to have laws that help keep their communities safe but also prevent them from harm. The greater health benefits for the greatest number of citizens, that is the most important aspect of public health law, instead of focusing on an individual health law to protect the greater good of the public. For example, preventing smoking in public areas, a requirement that all children have their immunization. This is a state requirement. In some states it might be different. Protecting of the human and well-being of the public is a certain role that public health law ordains. It also plays a part in expressing a culture's belief of what public safety is about. For example, it is unlawful to drive without a seatbelt in some states. One of the goals of this law is to display what is an acceptable form of behavior in a particular community. Wearing seatbelts while being transported in a vehicle should not only be done because it is required by law, but also because it is an ethical behavior that protects and respects the safety of the citizens of a particular state or community. Social and cultural norms can be influenced and altered by implementing of specific laws over time. The healthcare reform is another law that has been debated and people do not understand what it is about. But in the end, it is a law to help fund the healthcare services a person receives. The ethical thing is to buy the insurance, for it could help with getting the need assistance and will help with the public health as a whole. Funding of the community and public. Social Security Act 1935, funding for grants to states for public health services. National Mental Health Act 1946 funds training programs, mental health research, and community mental health services. Medicare and Medicaid 1965 funding health care services for the elderly and economically disadvantaged. The funding of federal dollars goes to the states for health care. Partnership and Health Act in 1966 awarded grants for numerous health programs and state and public health services. With the increase of the federal budget, local, state, and federal health departments have limited funds. The Centers for Disease Control and Human Resources and Service Administration and other health programs will be cut back. They have to make choices to which programs will still be available, look for private sectors for funding and donations. Some have developed partnerships to achieve their vital health targets. The positive is that the Affordable Care Act will help those that qualify with insurance, and this will fund some services. Working people will have insurance through employer-based insurance programs. This will cover some health care services. The role of communication in community and public health programs. Health communication has a significance for essential every characteristic of health and well-being. It involves disease prevention, health promotion, and quality of life. Effective communication can improve knowledge and understanding of health risk and outcomes and provides the skills needed to describe the risk. Emphasis on behaviors and attitudes increases demand for proper health services and increases demand for unsuitable health services. Makes accessibility data to assist in making complicated choices such as choosing health policy, care providers, and treatments. Health communication can be used to influence the public schedule, sponsor policies and programs, influence positive changes in the social, economic, and physical environments, improve the delivery of physical health and health care services, and encourage social norms that benefit health and quality. In the end, the rights and treatments of an individual are of great importance. Sometimes there may be a need to override the individual's right when it comes to protecting the health as a whole. Public health law exists to ensure that the public's health and safety is held in the highest concern. Public health laws also demonstrates the standards which the state expects of its residents when it comes to specific health behaviors. Public health provides the legal framework within which standards exist. However, the community and the public will educate and communicate to individuals what to do to have a good life in society with the greatest asset. It is your health. That's it.